the total population of natives in Michigan, almost 60,000. They report out less than 1%. The hard part right now is that Michigan does not identify tribal affiliation per the county. So it's inferred that there are cases associated with these tribes in Michigan. It's just hard to determine how many. As we go through Minnesota, here we get a little better sense, specifically with the more northern counties and the reservations. Red Lake, obviously, 9 cases. I think there's a good chance that the majority of those cases are tribal related. Leech Lake gets a little more difficult. Leech Lake is a little bigger with Leech Lake is bigger with 3 counties, and so obviously the numbers are going to be higher, but it's going to be even more difficult unless the tribe itself identifies how many their cases are. It's going to be hard to discern how many there actually are. Even like in Scott County, where Shakopee, down in the lower eastern aspect by Minneapolis, 291 cases in Scott County. Now, we know that more than likely these are not all COVID related to the tribe, but it's inferred that there are cases there. The lower Sioux and Redwood, 3, Upper Sioux, Yellow Medicine County, 5. They've had 2 cases increase since from last week. Even in Mills Lake, more central to Minnesota, several counties, it's going to be hard to discern whether or not all of those are related. Now, the one thing that can be relied on, at least from a public health, the Minnesota Department of Public Health has determined the number of self-identified natives in Minnesota as 128 have had confirmation of coronavirus, and that's a 34 new individuals from a week before. So as related to the overall population of natives in the state of Minnesota, 75,000, that is a pretty low percentage, definitely less than 1%, which is good. But I think what's going to be more important as the days and the weeks go by is following these counties and following the tribes reporting will give us a better idea of how many true cases are in our region. Bringing it back to Wisconsin. So I do have some more granular information. So we know of the tribes here in Wisconsin and the counties that they reside in. Now, let's say Stockbridge is obviously in Shawano. 34 cases in Shawano, 9 new cases from a week ago. This gets a little more interesting because when you start looking at the numbers as a whole, 2,288. Well, we know that that's not the case. That's not Oneida, all tribal members. But as of yesterday, we do know officially that Oneida has 26 positive cases. 12 are in Brown County with 4 active cases, and 14 in Outagamie with 10 active cases. And those are official numbers, so 26 out of Oneida. Lac du Flambeau, I heard today that there's 1 case there. Nothing out of Le Coudray. Bad River, no cases. Red Cliff, no cases. Forest County, Pottawatomie, I heard of 6 cases as of today. and at least unofficial numbers in Winnebago Ho-Chunk, numbers are in the 20s. So when you start looking and hearing tribes officially report out numbers, you can obviously see they don't match up to what the counties and the health departments of the state are reporting out on. So officially, Wisconsin's Department of Health Services has reported 151 cases in Wisconsin that are self-identified as Native. That's a 23 new cases that have been confirmed from a week ago. So of a population of almost 52,000 total in Wisconsin, again, we're dealing with less than 1% of our Native population have been affected by the COVID virus. So a little more granular information. So it's pretty hard to put all these numbers together because it's piecemeal and it's word of mouth, and it does take time to get these numbers almost on a daily, if not on a weekly basis. So I'm trying to provide you with the latest numbers that I have, so at least the audience has a better understanding of what's going on. As I mentioned, the state of Wisconsin has reported out 151 cases, 6 deaths as a result of COVID. And these numbers have changed, obviously, since last week. There's been one new case, one new Native case that has succumbed to the coronavirus. And the two categories that are probably, it's going to be hard. The multiple or other races are unknown categories. We know from just numbers of U.S. Census and other research data that it's a good chance there are other natives being categorized wrongly and put in these other two category boxes. So it's a good chance that there are more natives. They are just not self-identifying when they have been confirmed with coronavirus. So it's good that the number is low, relatively speaking, but I do feel that it is probably underreported as of right now. So in Wisconsin, so this was as of last night, there were 70 of the 72 counties have showed up positive for cases. 1 hour before I presented this and had the slide deck already ready to go, the other two counties, the last two counties have actually showed up cases now. So all 72 counties in the state of Wisconsin have now had a confirmed case of coronavirus. And so as we go through counties, you could see that the highlighted green counties, these are the more significant ones. And I just want to kind of briefly go through what's going on in Brown County. So 2,100 cases, that's 153 new cases from a week ago. Milwaukee County, 4,200, that's a 1,000 case increase from a week ago. Dane County, Kenosha, and Racine. They are the other two counties, southern counties bordering Illinois. They have shown steady cases every day. And probably the 4 counties that have the highest number of cases is Milwaukee, Brown County, Kenosha, and Racine. They have consistently been high, relatively speaking, to all the other counties, and will continue to be high in the foreseeable weeks that I can tell. In Illinois, McHenry and Lake County, those are the two northern counties. McHenry, 12, almost 1,300 cases. Lake County, that's right along Lake Michigan, below Kenosha, 6,900 cases. And then right below Lake County is Cook County at 27, and then Chicago, city of Chicago, almost 39,000 cases. So relatively speaking, Chicago itself has more cases than the entire state of Wisconsin. So that's pretty remarkable when you start comparing locations and cities to not only Wisconsin, but also to the counties that you may be residing in. So very different demographics, and it really does have population density plays a huge role in a lot of these numbers. Bringing it back here to Milwaukee and Milwaukee County. So 5,500 cases, 244 reported deaths. In the center slide here, you can see the yellow circles. The smaller the circles, the fewer cases. The larger, the more cases. Now, this is a 7-day map of what's been going on in Milwaukee. When coronavirus was being confirmed in Milwaukee, that was the the flip of what's going on right now. You were hearing a lot of headlines in the news about the north side having a lot of cases, and that certainly was going on. That was without a doubt. There were a lot of cases, new cases going on the north side. That is becoming fewer and fewer, and now majority of the new cases are coming from the south side. And you can see where the density of all of these cases are. Just south of the highway, right where our clinic is smack dab in the middle of this, and we're certainly seeing our cases of the virus. And so what was happening a month ago has slowed down and has now moved its way down into the south side of Milwaukee. On the left, you can see where the confirmed case count by age range. You can see the demographics and the age groups by which cases are being categorized. In the very beginning, most of these cases were to the far right. So 60, 70, 80-year-old demographic age groups, that's where most of the cases were coming. That's not the case now. That has slowed down, and now we're seeing more of the 30, 40, 50 age groups showing the majority of the cases now. So that's the trend that's going on, and I foresee that going on for the foreseeable future. In the far left-hand corner, you can see the number of new cases per day. A lot of zigzag up and down, and as of yesterday, we had a pretty significant spike in the number of cases. And you can certainly contribute that to the active testing sites and all of the health centers that are testing right now in the city of Milwaukee. So, you've heard about the National Guard being present on the north and south side, and they're certainly doing their share of testing right now. And probably the majority of testing comes out of these two sites. So cases are popping up through their locations. Getting a little more closer to us in terms of demographic breakdown. On the left-hand side, you could see the pie graph distribution. American Indian and Alaskan Natives alone at 0.4%, 0.4%. So that is significantly lower than the other racial and ethnic categories. And when you look on the right-hand side, you can definitely see the proportion difference between African American, Hispanic, or Latino, non-Hispanic whites, and then when you get further to the right, second column, you see American Indian, Alaskan Natives alone, 18 cases. 18 cases in the city of Milwaukee. That's what's being reported out by the Milwaukee County Health Department. So that's the kind of numbers we're dealing with and we know of here in Milwaukee. So so that was, I hope that was helpful. I'm trying to get as much information as I possibly can to help inform our Native population of regardless of what tribe. uh, what's going on in our region, in our state, and in our city of Milwaukee. In terms of risk, as was mentioned previously, individuals 65 and older, people who reside in long-term care facilities, nursing homes are definitely at high risk. Individuals with underlying medical problems such as chronic lung disease, so COPD, moderate to severe uncontrolled asthma, heart conditions. And I mean heart conditions like people who've had mitral valve replacements, congestive heart failure, individuals who've had cardiac arrhythmias or heart attacks. Those are the more serious heart conditions. High blood pressure alone isn't, but the other secondary heart problems are. Immunocompromised people, certainly individuals who are undergoing chemotherapy for cancer treatment, uncontrolled medical problems such as diabetes, liver failure, kidney failure are definitely at risk. Other autoimmune disorders and individuals who are on corticosteroids for management of autoimmune disorders, their immune system is suppressed by their medication and puts them at risk for contracting the virus. So these are certainly individuals that are at risk and should take the necessary precautions to reduce their exposure. Taking steps to protect yourself. This has not changed from a public health standpoint. Washing your hands, always important, especially after blowing your nose, coughing or sneezing, or definitely being in public places and being in direct contact with your surroundings. If you don't have soap, hand sanitizer is just as good. But the preparation has to be ethyl alcohol at a 60% ratio or higher. And it's always important to avoid touching your eyes, nose, and mouth. So washing your hands, obviously, safe distance, 6 feet, and limiting your exposure as much as possible. Now, last week, we talked about getting on the same page, and we went through several of these points through a discussion. Well, I have another page. So let's get on the second page. And so I'll go through these, and these are certainly questions that people have. They're always being asked, and it's always important to keep people well informed. So the first one, can getting the flu vaccine protect you from COVID-19? So the quick and easy answer is no. The flu vaccine does not protect you from COVID-19. COVID-19 is a coronavirus. The flu is from the influenza virus. Two different viruses that don't cross-react, and they're completely separate and independent of one another. So flu vaccine is for influenza, and unfortunately at this time we do not have a vaccine for the coronavirus. Packages from China spread coronavirus. So no, packages from China do not spread coronavirus. It really is any packages, and the exposure to yourself is by direct contact, where coronavirus may be on, but it really depends on the last person who may have touched that package. So the answer is no, but it is important to limit transmission and your exposure. Obviously you need to handle packages, but it's important that once you do, that you do need to wash your hands after that. So, rinsing your nose with saline protects the virus from getting in that way. So, There are saline solutions that people do to help clear their sinuses and drain any mucus, but normal saline solutions do not protect you. It doesn't rinse out the virus. Once the virus, and you have to think from a microscopic standpoint, once it is and gets onto your mucous membranes, it can't be washed away. It will get absorbed, and so rinsing your nose with normal saline will not protect you or get rid of the virus in that way. So the best way is actually just reducing your exposure as much as possible. So if that means covering a mask in high-risk areas, I would certainly suggest doing that. If you have the virus, you'll know it. Well, I think in the beginning, we certainly thought that was the case. We know that the virus does cause flu-like symptoms. So that includes a fever, a cough, can be productive. If it gets worse, it can lead to pneumonia, a viral pneumonia, which can lead to being short of breath, which can lead to chest pains, muscle aches, body aches, joint aches, fatigue. These are some of the more hallmark signs and symptoms of having, knowing that you have a illness, and more than likely at this time is related to coronavirus. That was in the beginning, and we were looking for individuals that had high fevers and symptoms. Well, we know now that there are definitely asymptomatic carriers and that don't have any of these symptoms, or if they do, they're very mild, if at all bothersome to the individual. So these are individuals that can certainly transmit the virus, but you do not have to have symptoms to have the virus. That is what we know now. Tamiflu is a preventative method against coronavirus. Well, Tamiflu is an antiviral medication. It's an oral medication and directly affects the virus, the influenza virus. It has activity against it and helps inactivate it so your body has a chance to kick its immune system into gear to fight off the influenza. Now, this particular medication, Tamiflu, has no activity against coronavirus. It's certainly being tested right now, but more recent articles that have come out shows that it has minimal activity against coronavirus and wouldn't be not only wouldn't be a treatment, but also would not be preventative in contracting the coronavirus. Rubbing garlic in your nasal passage will prevent you from catching the virus. Now, I don't recommend it. There's nothing to suggest it. There's been no documented reports or studies to even suggest that garlic works. And so I would not recommend using garlic or any other product in the nasal passage. It won't work. It won't work. The last one, and I know this goes around quite often, is you should not use money or refrain from using paper money because of the virus stays on paper longer than any other surface. Well, we know that the virus in its droplet form can stay on surfaces for a prolonged period of time. Now, surfaces that we know for sure are the hard, non-porous surfaces. So that would be, metal or plastic surfaces that don't have any pores in them. It's been shown that they can last up to anywhere from 24 to 72 hours. Every other surface area lasts less than that. So as far as paper, the number of studies and articles that are out there right now are pretty limited. And, you know, if you felt uncomfortable about using, you know, paper money, using cards, plastic cards, certainly can be at least reassuring. If you have it, that's great. Obviously, you'll need to clean that plastic surface off as well. So there's really no way of getting around exposure other than trying to minimize it. So if you don't want to use cash, paper money, that's fine. Use plastic, but using plastic means that you will need to clean those surfaces. And the bottom line is to limit that exposure, you'll need to wash your hands often as well. So there's really no way around it. Whatever surface that may be on, if you come in contact, you'll need to wash your hands. I mean, that's the bottom line. So just to let the audience know, we have our Safer at Home kits. We have personal hygiene kits, cleaning kits. These include detergent, laundry detergent. We have bars of soap and bleach products that we hand out freely. Just call us, let us know. We'd be more than happy to provide you with the cleaning products that you would need for just the day-to-day. And we're happy to refill those if you have gotten one in the past. Our circles of strength, we know that the majority of people are still abiding by the safer at home, staying home, limiting their public exposure. But with that comes other health, mental health, and even domestic violence and sexual assault concerns. And these are real issues. We have programs at GLIC that will help support and provide assistance. So if you do know individuals that may be victims of such, please feel free to have them call us. We'll be more than happy to assist during this time. And it's always important to know that if you have symptoms, and symptoms of fever, of a cough, maybe you got shortness of breath, sore throat, maybe a headache, extreme fatigue, body aches, nausea, vomiting. If any of these symptoms sound like maybe what you may be going through right now, you have an outlet. You have access to testing sites and you can get tested anywhere. But just know at the Ignace Indian Health Center that we provide that testing as well. And we provide same-day testing. Just call us ahead of time. We'll set you up with a time to come in. We'll ask you a few questions. We'll screen you and do an assessment and test you on the spot. So please don't hesitate if you feel you or any of your loved ones in your family feel they may have the coronavirus. Please call us and we will provide that testing for you. Just a reminder, it's always important to wash your hands, maintain that social distance, avoid contact, limit your exposure as much as possible. And if you're sick, don't go to work. Call in sick and you may need to get tested, which is okay. And this is a picture of our staff at the health center. Like I said, we have our testing processes all set up in place. We have our canopy, our carport, and the individuals that help support our efforts. So please don't hesitate to call us if you have any signs or symptoms or feel the need to be tested. So Jeremiah, Mark, I'll turn this back over to you guys.
I do want to come on and say that, again, a lot of you that are with us who are still at those numbers that are very actively involved in our community. I just put in very badly in our chat window just a support that the Oneida election the Oneida primary election that was scheduled for this Saturday, May 23rd, has been canceled by the election commission. That is not a result of a decision from the business committee. The election commission the election board, is a separate body from our tribal council. So please share that information with your contact. We do have a voting place here in Milwaukee, Southeast Oneida Tribal Services. Don't go to there to vote, because there will be no voting. As of today, I just called the election board, and our general election, tentatively scheduled for Saturday, May 25th, is still on. So that is tentative, they said. They're working on how to do it safely, but just please let all your Oneida tribal members know who vote in these elections that there's no primary this Saturday. Jeremiah, if you could relate some of the questions that have come in to Dr. Ignace.
Yeah, definitely. Thank you, Mark. And just right off the top, I want to say apologies for what was happening earlier. That's completely out of our hands. So apologies for what was seen there. Obviously very offensive, and we do not condone any of that. So with that, we do have a few questions here. One I think speaks to me for sure. As the weather continues to get nicer, we all want to spend some time outside, have some fun. Can you speak to if and how heat or hot weather will impact the virus's spread, and will we see a reduction in coronavirus cases come summertime?
So first part, I'll take the second part first. In terms of seeing reduction this summer, obviously with individuals, better weather, school, no more virtual school, kids, families, what we're accustomed to doing during the summertime, we'll certainly want to get back to that. However, obviously there's going to be limitations. So, I think the weeks, in the next couple weeks, with being more active, the weather nicer, people being outside, time is going to tell us whether or not there's going to be an uptick or a decrease in the number of cases. And it's hard to say. I think time will tell us, and time the numbers will certainly guide us in that approach of what we need to do. As far as the heat, we do know that climates that have more UV direct sunlight and higher humidity, that the survival of the virus in its atmosphere is a lot less than in colder, less UV light or darker days. And what I mean by that is less light and colder days, less humidity. The virus survives longer. So Wisconsin, I think, unfortunately, we do get our sun, but we don't get a lot of humidity. I think what would be different is, let's say, down in Florida, or maybe even our Central America countries, where, yes, there are definitely warmer, sunnier, exposed, hotter days with higher humidity. I think this summer will tell us more This is a new virus, and it's going to tell us a lot over time. We've only been dealing with this for a short period of time, so we don't know all of the information that comes with even seasonal changes. But I think in terms of heat, sunlight, and humidity does have an impact on the virus's survival and the potential for exposure to people.
I want to take on kind of one of the questions and expand on it, and that is kind of on a personal level. There'll be two parts: one personal, the other kind of larger scale. Should someone contract the virus, COVID-19, because it is spreading, we saw the graphs. And a best result is that someone recovers. Are there any lasting effects once someone's defined as using air quotes right now, recovered?
Mm-hmm. So again, this is a new virus, and people, we're seeing more and more people recover from the virus. There are kind of lingering effects that are being reported out. Fatigue is definitely one. Endurance is another. Lung function and capacity is another side effect. Even though you're not active, you've recovered, there may have been some injury and damage to the lungs itself. So even individuals who may be perfectly healthy and have, do everything right health-wise, if they do get coronavirus and do get really sick, they may have these lingering effects afterwards. There are other associated things that have come out of this. People have had strokes, people have had kidney injuries. So it's not just getting a virus, getting sick and recovering. It is, yes, that plus other secondary health complications that have come out of being exposed and recovered. So time is going to tell us more. What are these lingering secondary effects of the virus? Hopefully someone will be able to write a paper here shortly and kind of outline what are all the secondary complications that affect people.
I'm going to take the second part of that question, Jeremiah. You can handle the next one that's in our screen. Kind of just, I know that the patients you're seeing has upticked quite a bit. And the question is just kind of from your perspective as a doctor at our Indian Health Center in the largest American Indian community of residents in the state of Wisconsin, what are you seeing that potentially, or even right now, this COVID-19 is having for our community? What are the long-term effects it's having on our community?
We know that the disparities of care, health conditions, are certainly greater than other racial ethnic groups. We know about cancers, we know about diabetes, we know about cardiovascular diseases, and the health disparities that are related to that. Another perspective of not only what we see but what we know are unemployment. We know about income levels. We know about workforce development. We know about education. We know about living conditions. And so these are all additional disparities that impact natives in the urban setting, not just rural and reservations, but certainly can have its impact here in a rural, in an urban setting. So combine that with what is going on with the virus and what we know with health disparities. So we know natives are at risk. They're in those high-risk categories just because of health conditions. But we also are dealing with multi-generational living and the impact that if one individual becomes infected with the virus, that other people in that house may become, and certainly multi-generational living, aunts, uncles, older aunts and uncles, grandparents, people that may be over the age of 65, their risk goes up exponentially. So these are just situations that we know are unavoidable. We can't get away from that. We know that income certainly has an impact on health. And before this virus started taking off, we know unemployment across the board for all racial and ethnic categories was decreasing. And Natives workforce development efforts were ramping up and were effective in not only supporting but also advocating for Natives in positions. So now that this has happened and the shutdown occurred and people are being laid off, furloughed, with the hopes that their jobs are safe when they come back, it's going to be hard. The economic impact is going to be devastating for a population that has a high percentage of low income. It's not only was devastating before, but it can be even more, especially if a family member is the sole provider for the entire family. That can not only have its short-term, but also its long-term effect as well. So it is multifactorial. And if there was probably ever a time that could impact every level of Native in the community, it would be right now. All of this together is almost the perfect storm for bad things to occur.
One of those bad things I'm going to add to this conversation and its direct effect on our Native community, this Native to Native conversation that we're having is important because we need to share information about what's happening with our young people. And so while our young people might be not as having a health risk as older people or vulnerable people are to COVID-19, their lives are being affected, and they're being affected in this way. And I need each and every one of you that are listening to this and have young people that are going to college or about to enter college. The tribes in their ability to help students go to college has been deeply affected. And I can't speak for Oneida Nation, just having relatives, with the usual amounts of money that are available for students to help them just by identifying themselves and qualifying for college has been reduced by a significant amount of money. The effect on the UW system, just as an adjunct lecturer at the University of Wisconsin-Milwaukee, has been nothing less than, as our leadership has talked about, catastrophic in going forward for the university system. So just when it comes to higher education, please, I'm asking folks that are working with tribes and their young folks and the ability of what school looks like. Are they going to be able to attend? A lot of that has to do with the financial aid you have coming in and what the university is going to look like. So please contact your contacts at the university and those folks that help you with your financial aid packages with the tribe, wherever tribe you belong to. And that is one of the very personal insight I can give you. And that piece came over the phone. So I'm going to say, you guys, you can ask the questions in our chat box here. But I just wanted to address that larger effect for everyone. And okay, Jeremiah, going to you.
Sure. Thanks, Mark. So this one actually comes in via Facebook. We are streaming this Facebook Live as well. And it kind of goes back to what you were talking about, Dr. Gnase, about, the struggles that some people are going through as far as, possibly being furloughed or laid off from their place of work. There was a question of, during this time, is the Gerald L. Gnase Indian Health Center offering care? Obviously this person is without insurance at the moment. Are we offering care to those without insurance at this time? And then also, I guess, a side question would be, offering testing as well.
So, yeah, this is a more than difficult time for all socioeconomic status individuals here at the Gerald L. Gnase Indian Health Center. So whether you have insurance or not, we will see you. As far as testing, whether you have insurance or not, we will test you. The testing is free. In terms of health services, if you have insurance, okay. If you don't have insurance, not a problem. We will still provide care. We provide medical services. We provide dental services, behavioral health services, physical therapy. We provide, we also have a pharmacy as well. So we offer medications at a greatly reduced discount, not only to us, but that is also passed on to individuals that may need a prescription. So whether you have insurance or not, we will provide care for you. Not a problem.
Thank you, Dr. Gnase. And we actually, another question, this goes back to something you were speaking to earlier in the presentation about, I believe it was one of your myths to debunk, was should I, only use credit cards or not use cash at all? And the question was, is it necessary to disinfect your debit or credit card after using it in a public place?
Yeah, so everyone's in their new norm. Everyone's trying to do the best they can to reduce their transmission of the virus. As a general rule for myself, anything that I have in terms of plastic, even the keys that I drive with, my driver's license or my card, I make it a habit. It may stay in my pocket all day, but if I use it once, and you either have to put your card in the box or slide it, I will, if a store has that little hand sanitizer, I'll take a little bit and just wipe down my card, my plastic, right there on the spot, and put it back in my pocket, and I'm ready to go. So before this happened, I wouldn't have given it a second thought. But just knowing from a health perspective standpoint, I assume everything I touch has the virus. So as a result, I'm probably overzealous in my effort to keep things as clean as possible. But that means I don't get it, then I'm okay with that.
So my question, and someone else just texted me, is the Gerald L. Gnase Health Center a COVID-19 testing center? And they sent me this picture looking at the tent. I think either that was before or after hours.
Yeah.
That's outside. So if you might answer that one.
So we are a testing center. We've always been a testing center. We've from the very beginning, we've been testing individuals on the spot. So we've been able to ramp up our efforts, and we are collaborating with other FQHCs, not only in the city, but also collaborating with the state health department, as well as other community health centers throughout the region, in support in our effort to not only assure people have access to testing, but also having the capacity to test as often as we need. So we are a test center. We are a test center on the south side. You don't have to be established with us to get tested. The only thing we ask is that you call us before you do, and we will set up a time when to do that. You don't have to be a regular user of our facility. We just ask that you call us ahead of time. That way we can process people in a kind of organized, orderly fashion. And if you do call us and set up a time, you will definitely get tested.
We do have a question that's kind of overall and looking at just as a doctor and you're looking at professional periodicals and so forth. This coronavirus, COVID-19 that we have in our communities and spreading, do you think that as researchers look back or literature comes up that perhaps it will be discovered that coronavirus was here, this coronavirus specifically was here before it being known about or talked about? Certainly we saw a lot of conversation in January. Mm-hmm. We talked about, well, was it here before originally reported out? What do you think? Will people discover that it was here before the first public reports?
So, and you know, maybe this is something I could present next time, but we hear about coronavirus, we hear about COVID-19. Okay. Well, I think everyone needs to know that coronavirus itself is not new. Coronavirus historically has been around. It's been around with the SARS and the MERS virus, and that occurred several years ago. We know that there are seven different types of coronavirus. And we know that at least four of the seven known coronaviruses that exist are even here in Wisconsin, even before this even occurred. Those types of coronaviruses actually cause the common cold. We know that because we've tested it historically in previous seasons, and they've come back as coronavirus. And so when we talk about COVID-19, and everyone says, well, this is a novel virus. Well, this particular coronavirus, it is. But historically, there have been coronaviruses in circulation for years. We know this. We know about this from other pandemics that have occurred. And we also know this because coronavirus does cause the common cold during flu and cold season. So it just happens that this particular virus, this novel new coronavirus, the SARS-CoV-2 is actually its official term, is new. CoV-1, coronavirus 1, was SARS several years ago. So this is a new corona strain virus.
One question I had offline before today was when someone, if they don't go to the center, the IHS center here in Milwaukee, they're reporting to one of the stations with the National Guard. Mm-hmm. There's concern about what is it that they're asking for? Are they looking for driver's licenses? Are they looking for some kind of ID? Are they just, what is expected if you get tested at that site or those kind of drive-by sites? What do you need?
Mm-hmm. So their testing is free, and Jeremiah, you may know this a little better in terms of the details, but as far as requirements, I think name and a working phone number and a driver's license may be the minimal essential things that you need to show up with. You don't need money. You don't need your credit card. You don't have to pay for the test. You just really just show up. They are a walk-up testing site. So in terms of notifying, they do need to know where you live, and they do need a way of getting a hold of you. So a place of residence and a phone number. I would think at the very minimum they would want from you.
Yeah, I believe actually most of the more in-depth questions about, maybe if you have a provider or where you would like to go to see a provider would be asked of you upon the health department calling you to give you the, negative or positive test. But yes, when you go to the actual site, it's very kind of come as you are, like you said, ID, drive up, and testing for free. So
another question that I had gotten offline is someone just in a general sense, it's kind of when they leave the house, they're concerned they're in a multi-general home situation, older person who could be at risk if they get COVID-19. So what exactly is PPE and what is recommended when they go outside? Now, we do have a picture in front of us of folks with face masks and so on, but in this multi-generational house, what is it that they need in let's say a shopping trip? What does PPE look like?
So the personal protective equipment, that's what PPE stands for, personal protective equipment. So the picture that you see here, and if you're not on seeing it right now, so that basically is a covering, protective barrier covering. So that may include a face shield with a face mask or just a face mask alone. There are other equipment that could be for even closer recurrent contact with people, and that's the gown. That is that kind of wraparound gown. It may look blue, it may be white, it may come in yellow, dark blue, light blue. It is a protective barrier between yourself and the person that you come in contact with, and obviously gloves. So that's kind of a full protective outfit that you may see individuals wear. That's really reserved for close contact. And close contact, close contact would be, let's say, if I was to test you, or if you and I were in a closed room doing a face-to-face medical encounter, I may need, depending on the situation, I will need at least the very minimum of mask and gloves. If I was in the hospital setting where, let's say I'm in the ICU and I'm working one-on-one with the patient who has COVID on a ventilator, my protective personal equipment may be more extensive. I may be wearing a hat, I may be wearing goggles, I may be wearing a face shield, as well as a face mask, the gown itself, gloves, and protective covering over my shoes. That would be a full garb of PPE. That would be in your most direct contact with people, individual, face-to-face. For the day-to-day, when you're at home or in the public, I think at the very minimum, people should at least obtain and use a face covering when they're in the general public in areas that are with a lot of people. And that would include the grocery store. That would include going, let's say, to the shopping mall, going to Target, going to Walmart, going where there are a lot of people around you, just to minimize your risk, a face covering at a minimum. Some people have more of the upgraded medical face mask. You could use that. The only problem is that they break down after 3 to 4 hours of use. So it's not a face guard that you could use for prolonged periods of time or multiple times in a week. They're one-time use and they're effective up to 3 to 4 hours, but then you got to put a new one to get the same level. So when you're in a multi-generation home, I think the best thing that you could do would look at would be to wash your hands and clean your surfaces, clean and disinfect your surfaces, um, and minimize, you know, contact as much as you can to people that are definitely at risk, high risk. And I listed out, some of those individuals that may be high risk are elders or individuals that have chronic medical conditions. These are the individuals that we absolutely have to be protective of, even in the multi-generational living situation. So I'm not saying you have to wear masks 24/7, but I think when you're going from public to home, when there's someone at risk, you need to take the precautions of a routine of changing, showering, and washing your hands often, as well as cleaning and disinfecting your surfaces.
So our session's coming to an end. We in general, we end these sessions at 4:30, but I do want everybody to know out there, we are thinking about you, and this is a native to native conversation, and we have questions about COVID-19 in our ceremonies. One of the things that we're going to be talking about next week is the Indian Council of the Elderly and the Indian Health Center will be working together in establishing some safe protocols in creating the presence of fires. A lot of times we'll do them for those who've departed. Some of our religions, they'll use one day, because that's just all you need to burn the tobacco and be present at a certain part of our ceremony. Others will use 4-day fires. And it's come forward from some young men coming towards me that they'd like to have a 4-day fire for our entire community, because right now, not a lot of us are being affected and we're not showing up in percentages. Well, we all know as a tribal community, when it comes, we are tribal people, and more than likely it's going to be going through our community because of our close social ties and connections to each other. So the Indian Health Center here in Milwaukee, Ignace Health Center, has been kind enough through Dr. Ignace to put together a protocol for keeping that fire. And there's going to be a demonstration of that in prayers for our community, and that's been approved by the Indian Council of the Elderly. We'll have more information about that at our next gathering. But we are at the end of the time, and Jeremiah, I think you got some magic to share with everybody. A little love for certainly at least giving something back to our community for tuning in and being a part of the answers, information centers for our families, and just a small way to say thank you for tuning in today, and kind of taking a chance at something that no one really asked for. It's just our way of saying thanks. Jeremiah?
Yeah, thank you again, Mark. So seeing as I had reached out to a couple people via the chat box, so I'm going to reach out to you, I guess, vocally here. So Wendy R., if you're still in the chat, I believe you are still viewing here, as well as Stephanie, just Stephanie, no last name. My 2-year-old son has chosen your names out of a hat, so if you would like to redeem your gift cards, all I would need from you is to please just either send me your email address or phone number via the chat box, and I can get in touch with you to get your address, and we can get this out to you. And just like Mark said, just a thank you for being a part of this today. And all we ask is, to kind of spread the word to your friends, to your family. That's why we're here. That's why we're doing this, just to get the word out, get the message out, and keep people informed.
Dr. Ignace, as we close out each of our sessions, we're going to give you the time to let everybody know some final thoughts on your part, and we will close our Thursday afternoons. And from me, looking forward to talking to everybody next week. Please pass on what you found out. Please prepare other questions and ask the folks that you can represent and advocate and represent their questions at our next session. Dr. Ignace?
Yeah, so over the last several months, we've heard numbers after numbers and the devastation and the impact of not only in the world, but also right here in our urban settings, in our rural settings, in our families, and people that we know have contracted the virus, and unfortunately, some have passed away. As bad as the numbers may seem, there are hopes. I think there is hope. I believe there is hope. I am optimistic that we will get through this. It's going to take some time. And I think what's really fortunate, and especially this week, is that we're hearing more about treatment options. We're hearing about therapeutics. We're hearing about vaccines. And every day that I hear and read there, it reinvigorates my optimism and my hope, not just as a health provider, but as a provider for the Native community, that there is light at the end of the tunnel. And every day that passes and every week that passes, I feel it's getting brighter. And so that, in addition to an effort like this of keeping the community informed, offering at least my perspective in what's being developed, and getting that to the Native community. There aren't very many avenues to do that, and some people may not be socially plugged in. But if this is an opportunity for the Native community, even if you hear it and you pass this on to your family members, that is one more person that may be protected and free from this moving forward. And to me, that's a success. And so every person that can limit and reduce their exposure, the better. And for Natives in Milwaukee, in the state, in the Bemidji area, I just hope and I'm thankful to be here to offer at least this advice and information to help protect you and your family and your loved ones. So do take care and protect yourself and wash your hands.